video is aimed at newly qualified pharmacists or anyone looking into hospital. Here's a very quick guide on how I clinically screen a hospital prescription. The first thing I look at are the patient's details. What is their age? What is their gender? These are all relevant to pharmaceutical care plans. I look at bloods and make a note of anything notable. So things I look at are, do they have any clotting disorders? Are their platelets okay? Have they got any renal impairment, any hepatic impairment? What are their inflammatory markers if they've got an infection? And then I also look at their reason for admission. That's very important. Their past medical history, because then that looks at what sort of information you're trying to gather. Looking at their observations such as their blood pressure. I then check the drug history and see if that's been prescribed appropriately. Right dose, right route, anything along those lines. Does the patient have any swallowing difficulties? Are there any important medicines that need to be held? Have they got an infection but they've still been prescribed dapagliflozin? Does that need to be held on admission? That kind of thing. VT prophylaxis as well. Has that been prescribed? Has it been prescribed according to the correct body weight, according to their renal function, or has it not been prescribed? Actually, it wasn't appropriate in the first place because they've got an active bleed. Have they been prescribed painkillers? Are they in pain? And if they have been prescribed opioid painkillers, have they been prescribed laxatives alongside it? There's lots of different things to consider, and I suppose the ultimate goal is making sure that the patient's treatment is safe, but also that the treatment is optimized. The way that I ensure that it's optimized is by looking at relevant guidelines, looking at the patient's plan. So what have the doctors planned for the patient's treatment?